Hello there, and welcome. Today, we are going to talk about a condition you might have heard of, especially if you've recently been on antibiotics. It's called C. diff colitis. We're going to walk through what it is, why it happens, and how it's treated, all to give you a really clear, straightforward guide.
So picture this. You just wrapped up a course of antibiotics for some infection. You're expecting to feel better, right? But instead, you get hit with a totally new and, let's be honest, pretty awful set of symptoms. This exact scenario is a super common starting point for what we're talking about today. Okay, let's get into it. All right, first things first. Let's get properly introduced to the main character in this story, a little bacterium called C. diff. Now, it's not always the bad guy, but under the right circumstances, it can become a real unwanted guest. So here's something that might surprise you. C. diff, that's short for Clostridioides difficile, can actually live inside a lot of us without causing any trouble at all. It's usually just a quiet, minor member of the huge community of germs living in our gut. To really wrap your head around this, let's use an analogy. I want you to think of your gut as this beautiful, thriving garden. It's absolutely packed with thousands of different types of good plants. All these helpful bacteria that work together to keep the whole system and you healthy.
So in this healthy, balanced garden, C. diff is basically like one tiny little weed. Yeah, it's there, but it doesn't have any room to grow because all the strong, healthy plants are taking up all the space and resources. Everything's living in harmony.
But what happens when that beautiful balance gets disturbed? Well, that brings us to the tipping point, that moment that allows this tiny little weed to suddenly explode and take over the entire garden. The most common trigger, and I mean by a long shot, is taking antibiotics. Now don't get me wrong, they're amazing at killing the bad bacteria that are making you sick. But a lot of them aren't very selective. They're kind of like a powerful weed killer that just wipes out everything. Not just the bad guys, but a whole lot of your good protective bacteria too. So, with all its competition suddenly cleared out, the super tough and resilient C. diff spores can spring to life. They start multiplying like crazy, taking over all that new, empty real estate in your gut. And as they grow, they release these toxins that inflame the lining of your colon, and that is what makes you feel so sick.
Okay, so this naturally leads to a really important question. Who's most at risk for this? Well, like we said, recent antibiotic use is the #1 biggest factor. But other things can play a role too, like being 65 or older, having a recent stay in a hospital or a nursing home where C. diff spores can hang around, using certain medicines that reduce stomach acid, or just having a weakened immune system in general.
All right, so you know the risks now, but how would you know if you actually have it? Let's talk about the key symptoms you've got to watch for and how doctors figure out what's going on. The #1 telltale sign of a C. diff infection is persistent, watery diarrhea, and that usually comes with some pretty nasty abdominal cramping and pain. You might also run a fever or feel really nauseous. If you have these symptoms, especially right after a course of antibiotics, you need to talk to your doctor. Now, the good news here is that finding out for sure is actually really simple. There are no invasive procedures needed to get started. A doctor will just ask for a stool sample, and that sample gets tested in a lab to see if the C. diff bacteria, or the toxins it makes, are there. Once you have a diagnosis, your doctor will figure out how severe the infection is. And what that really means for you, the patient, is pretty clear. A non-severe case can often be treated at home with pills, but a severe infection, that might mean you need to be in the hospital for stronger treatments and to be monitored more closely. And now, we get to the most important part, fighting back. C. diff is definitely a serious infection, but the great news is it is treatable. So let's look at the main ways we can get that gut garden of yours back in balance.
Now, it might sound a little strange, right? Treating a problem caused by antibiotics with another antibiotic, but this time it's totally different. Doctors use a very targeted antibiotic, like vancomycin, that is specifically designed to kill the overgrown C. diff bacteria while doing a lot less damage to the rest of your good gut bacteria. This is such an important question because for some people, this infection can be incredibly stubborn and it can come back even after you finish treatment. We call this recurrent C. diff, and believe me, it can be so frustrating for patients who go through it. So for these recurring cases, there's a really effective therapy called a fecal microbiota transplant, or FMT. And yeah, it's pretty much what it sounds like. It involves taking stool from a healthy screen donor and introducing it into the patient's colon. It's literally like reseeding your damaged garden with a complete balanced community of healthy plants to finally restore order. And how well does this reseeding work?
Well, it's incredible. The cure rates for recurrent C. diff using FMT are consistently over 80%. It is a truly game-changing treatment that has given so much hope and, an actual cure to people who were stuck in that cycle of infection.
Now, I do want to mention one more thing. In very, very rare and extreme cases, the infection can cause such severe damage that the colon is at risk of rupturing. In these life-threatening situations, surgery to remove the damaged part of the colon might be the only way to save a person's life. But I want to stress, this is an absolute last resort, and it is not common.
Getting through a C. diff infection is a huge, huge relief. So the final step on this journey is just learning how to stay well and protect your gut health moving forward.
Okay, let's talk prevention. Here are 3 simple but really powerful steps you can take. First, you have to finish your entire course of C. diff medication, even if you start to feel better halfway through. Second, hand washing is key. C. diff spores are really tough, and washing your hands with good old soap and water is way more effective than hand sanitizer. And third, be your own best advocate. Anytime a doctor wants to give you an antibiotic in the future, have a careful discussion about it, and always remind them about your history with C. diff.
Wow, we've covered a lot, from the idea of a gut garden to treatments and prevention. Really, understanding that delicate balance inside our bodies is the first step to protecting it. So I'll just leave you with this to think about. Now that you know about your gut garden, what's one step you can take to help it thrive? Thanks so much for joining me.